Hello, my name is Dr. Jim Wood, and in this video I'll be discussing the procedure of vasectomy, what to expect during the procedure and what to expect afterwards. The timing for your operation slot is approximately 45 minutes, but of that quite a lot of it is us making sure that you're comfortable and making sure that you understand your post-operative care. The actual procedure only takes about 20 to 25 minutes. When you come for your vasectomy, it'll be carried out in one of our operating theatres, and there'll be a nurse and a surgeon present. We try to make it as a relaxed experience as possible. We have some music playing, and we encourage you to choose your own music if you wish. We ask you to get up on the operating couch with the lower half of your clothing removed. We then sterilise the area and put a drape over you. We then place some local anaesthetic in the front of the scrotum using a very fine needle. We put an additive into the local anaesthetic so it stings less, but it still does sting a bit. The needle goes under the skin and around the sperm tube. It does not go into the ball. Once the area is nicely numb, we then use a special instrument to make a small hole in the front of the scrotum, and through that hole we bring the vas, the sperm tube, out as a loop, and we then cut it and cauterize it. That means that we burn it. We then place it back in the scrotum. We then move the hole onto the other side and do the same thing on the other side. That means that you've just got one hole in the scrotum, but both sides have been done. At the end of the procedure, the hole is so small that it comes together nicely and doesn't require any stitches. We then put on some spray-on dressing and some gauze, and then you're free to go once we've been through your post-operative care. After your procedure, it's very important you look after yourself. We suggest that you do pretty much nothing for the first 48 hours after your procedure. For 2 days after your procedure, we ask you not to shower or bath, and then after that you can start washing again, but just have quick washes for the first few times. The reason for that is that the dressing is a spray-on plastic dressing, and if you wash too much, it'll strip it off. For 5 days after your procedure, it's important you don't do any significant lifting. The reason for that is that when you lift things, it can put a back pressure on the veins to your balls, and as a result, it can cause some bleeding. For 7 days after your vasectomy, you shouldn't do any significant exercise at all. When you get back to doing any significant exercise, you should just do a little bit and then see how you are the next day, because it can be that it won't hurt or cause any problems at the time, but it can cause problems for the day after. If you have any problems at all after your vasectomy, you need to seek review. There are 3 places you can get help for this. You can call us, you can call your GP surgery, or if it's out of hours, then you'll need to call 111. If you do call out of hours or call your own GP surgery, can you also make sure we're aware, because we would like to know if you've had any problems and contact you and follow you up and make sure that you're okay. After your procedure, it is normal to get a bit of scabbing and bruising around the wound, and occasionally a little bit of ooze from the wound. It is also normal to get some swelling of the testicles, the balls. This swelling should not be big. You shouldn't see any swelling that is larger than twice its normal size. If you have any concerns about swelling, it's important you seek help. You shouldn't get any spreading redness or any pus or any fever. If you get any of those, it can be a sign of infection, and again, you need to seek help. 4 months after your vasectomy, you need to do a semen analysis. This is for us to make sure that there's no sperm remaining in your semen. Until you've done that analysis and that we've told you you're clear, you need to assume that you're still fully fertile and you need to carry on using another form of contraception.